All right, let's go through compact bone histology, a review quickly, and then compare it to spongy bone histology, which you haven't looked at before. Okay, so when we're talking about bone histology, compact versus spongy, remind you what compact and spongy look like. So compact would be this dense bone that's really thick around the diaphysis, and then spongy bone is up here or here. So remember we said that when you were talking about compact bone, it was basically all made of these cylindrical structures called osteons, and then they were all smashed up close to one another. They were compact. Compact bone tissue is on the outsides of every bone. Spongy bone tissue would be terrible to pull on. And it's much thicker in the diaphyses of long bones than it is in the epiphyses, but that's not the only place it's found. It's really strong, really dense. It's really good at resisting stress, but it's also really heavy. And so let's just review the sort of structure of compact bone. So remember that what you have is these osteons. Here's one. Okay. And here is one that's blown up over here. Here's the whole osteon over here. And the osteons are running relatively parallel to one another. In the middle of each one is this structure that usually stains just really dark. What is that called? That is the central canal, okay? And inside the central canal is where your arteries, veins, nerves are running. The central canal runs parallel to the axis of the long bone generally. The central canals are lined by endosteum as well. I told you pretty much all of the internal structures of bone. Okay, and then what I have like from here to here is a layer of bone matrix, and a layer of bone matrix is called a lamella. Plural is lamellae, okay, and that's Latin for layer. And just to revisit what we talked about last time, this lamella would be made of bone matrix. And remember, we said bone matrix is basically made of, the metaphor I used was reinforced concrete. So it's basically collagen fibers that would have been made by the cells, and then calcium crystals that you pulled in from your diet, okay? And then the lacuna. The lacuna is the space right here that houses the mature osteocyte. So here's an osteocyte in a lacuna right there. Okay. You've already learned all of this. And of course, a mature bone cell that's primarily responsible for maintaining the bone matrix is called an osteocyte. It was derived from an osteoblast, and before that it was an osteoprogenitor cell. And then last but not least are these little connectors, these little spokes that allow the cells to communicate with one another. Here they are up close. Those are called canaliculi, and that means little canals, and they connect one lacuna to the other. They connect cells to one another. This is, the canaliculi is how you get nutrients and waste back and forth from like the central canal all the way out to the edge of the osteon, and then all of the stuff back in. Okay, so those are all the things you learned before. And there's one other thing on this picture that you didn't learn before, and that is how it's all related to the blood flow that we talked about before. So what we can see over here is, okay, so we see a central canal right there, right? And we already said that, okay, you get blood in from some perforating artery, and then it dives under the periosteum. But how does it get from here to here? Well, there's a new kind of canal that I haven't taught you guys yet, and that's called a perforating canal. And the perforating canal generally runs parallel-ish to the long axis of the bone and sort of goes from, let's say, under the periosteum through the perforating canal into a central canal, through another perforating canal, into another central canal, perforating canal, all the way to the medullary cavity. That's how you would get blood all the way into the medullary cavity. So that's a perforating, also sometimes called a Volkmann's canal. You will see this semester that historically they used to use eponyms, which is proper names for things, and they are really trying to move away from that. So a lot of times you'll run into like situations in which your notes has somebody's name and then a new name for it. Okay, so how do you make compact bone? You basically have osteon smashed up against osteon, smashed up against osteon, so that you end up with compact bone. Okay, so with that in mind, let us compare and contrast and look at how you make spongy bone. So, by the way, this is a cross-section of compact bone, and this is cross-section on the top and a long section on the side. So what about spongy bone? How do you make that? Well, instead of running all of the osteon-like structures parallel to one another, all smashed up against one another, you're going to run them at angles right there, right like this. So spongy bone has a very similar kind of idea and structure, but it's going to be organized a little differently. So when you look at it, again, it has this disorganized, spongy appearance. You find it on the interior of lots of bones. You don't find it on the outside of bones if all is going well. In long bones, spongy bone is found in the epiphysis, thicker in the epiphysis. You find it lots of other places in the body as well. The osteon type structures, first of all, they're not called osteons, but they don't run parallel to one another. They run at angles to one another. And they are called not osteons. They are called trabeculae. Singular is trabeculum. Okay. And if we take this and blow it up, we'll see it like that. And then look at it a little closer and you can see this trabeculum that looks kind of similar to an osteon, but it has some important differences. So let's look at that one. Okay, so notice the things that it has in common. It has osteocytes and lacuna. It has lamellae, right? It's got canaliculi, all of that good business. But it doesn't have a central canal in the middle, and that's because it doesn't need one. Because compact bone is so compact that really the central canal is where you can get the blood vessels in. But here, there's room all out here in this red bone marrow generally for plenty of blood vessels. So instead of getting nutrients from the inside to the outside like you do in an osteon, you get nutrients from the outside and they move in. Okay, so you do it that way instead. So this is called a trabeculum again, and plural is trabeculae. And the spaces between the trabeculae and here are going to contain usually red bone marrow. And that's how they get their nourishment. Okay, let's make sure we covered everything. Let's see. So they're not parallel. They're not called osteons. Okay, so how about this spongy bone? And this is going to lead us into talking about bone growth. So the spaces inside spongy bone that you're like seeing here, all of those spaces inside the spongy bone, if you were an infant or a newborn, all of those spaces would have red marrow in all of your bone. And red bone marrow is really important because it can do what's called hemopoiesis or hematopoiesis, which is the production of blood. But as you become an adult, you don't need to increase your blood volume. You need to maintain your blood volume. So by the time you go from infancy to adulthood, you lose red bone marrow many, many places, and you have it left behind a few places, which are going to be really important when we talk about bone marrow transplants. So you have red bone marrow left behind in the heads of your femur and the heads of your humerus. You also have it in some of your flat bones, like your sternum is considered a flat bone, and some of your irregular bones, your ossa cocci, these hip bones, these crazy looking things. You have red bone marrow left behind in there in an adult. And this is important because clinically, if you need to give a bone marrow transplant, like if you're doing a bone marrow donation or you're doing a bone marrow transplant to help someone with, for instance, leukemia. Leukemia, it's a blood cancer, but it's really a bone marrow cancer that causes a blood problem. And so what they would often do is kill off the misbehaving bone marrow in the person with cancer. And then you would need to get functional bone marrow from a donor. And that bone marrow needs to be able to make new blood, so it needs to come from the red bone marrow. So where would you get it? Well, you could, in theory, get it from the sternum or the head of the femur or the humerus. There's even some in your parietal bones, but you generally want to take it from some place that it's easy to access and also easy to heal. So it usually comes from the ossa cocci, the hip bones, and they usually take it from an area without much attachments. So the other thing about your bones is that most of the rest of the places are filled with yellow bone marrow, but your yellow bone marrow in a healthy person remembers how to be red bone marrow. So if, for instance, you were in your 20s and you hemorrhaged, but you lived, your yellow bone marrow could revert to becoming red to help you replenish your blood volume. Okay, we will start on ossification next time.